Thanks for that. So this session is being recorded, so we'll send the link afterwards. So if anybody has to leave early, if you've got to get back to work or be at a meeting, that's absolutely fine. And we'll send you the link to the recording to watch the rest later on. Before we get sort of properly started, I'll just share a slide about how you go about kind of using the features in Blackboard Collaborate for those of you that haven't used it before. So probably at the bottom of your screen, although it might be at the top if you're on a mobile device, you should have three little icons, one of a microphone, one of a video camera, and the raise hand icon. So obviously, if you do want to ask a question using the mic at the end of the session, that's okay. You can switch on your mic. You can switch on video if you want to. The main way that we take questions generally is via the chat though, and the chat you can access via the little purple kind of pull tab probably in the bottom right hand corner of your screen. If you click on that purple tab, the white box that you can see on the right hand of the screen here will pop out, and there you can access the chat box via the little speech bubble, or use the settings cog. Within there you can change things like your audio settings and your video settings, which might be helpful if you're having any problems. Back on the main part of the screen, there is the raise hand icon, the little person doing that. If you are having any problems during the session and you need to let us know about it, if you click the raise hand icon, then Luke or me will probably contact you privately via the chat to see if there's any way that we can kind of help you out. So those are the kind of main features of Blackboard Collaborate that you need to know about. Just switch back to my other slides. So just before we get going today, a few little promotional things from ScHARR. First of all, there's a link here to, and I'll put all these links in the chat box once the talk has started. Information about our Masters in Public Health and our Diploma and Certificate in Public Health programs that we offer at ScHARR. Liz, who's our main speaker today, is our Director of Learning and Teaching here at ScHARR and has input into our range of postgraduate programs, including the MPH and our MPH Online. There's also a link to our short courses. We've shifted some of our short courses to an online format, so you can find out more about some of those that are coming up over the next few months. And finally, there's our Facebook page. So if you want to follow us on Facebook, we are ScHARR Sheffield, and we use that page to promote information, obviously, about these kinds of webinars and other activities and things that are going on in ScHARR. We've also got a couple more talks, the next two that are coming up. We have a whole year booked in now, so we will be running these on a monthly basis until at least the end of 2021. But the next two that we've got coming up, in March, we have Professor Stephen Julius talking about case studies and exemplars of efficient study designs in clinical trials. And again, I'll put the link for booking to that in the chat in a moment. And then in April, we have Fiona Campbell and Elena Sheldon talking about the factors associated with student mental health, reviewing the evidence. So those are the next two coming up after today's session. So today we have Dr. Liz Croot. Liz is Deputy Director of the Medical Care Research Unit at ScHARR, and she's a Senior Research Fellow. Her research expertise lies in qualitative methodology, user-centered disability research, and complex intervention development and evaluation. And she currently holds a Career Development Award from the School for Social Care and is using this to explore how people with learning disabilities can be supported to make decisions about their lives. As I said, Liz is the Director of Learning and Teaching in ScHARR and has input into our range of programs. And today Liz is joined by Jodie Bradley and Vicky Farnsworth, who both work with the Speak Up self-advocacy organisation, which was set up in 1988 to give people with learning disabilities and autistic people a voice, employment opportunities, and to ensure that they are valued and included in society. Speak Up is run by and for people with learning disabilities and autistic people. Jodie is an advocate with learning disabilities and autism, and Vicky is a self-advocate with learning disabilities, and both have extensive experience of co-producing research and service improvements for people with learning disabilities. And again, I'm going to put the link to Speak Up, their webpage, in the chat as well if you want to find out more about their work. So I'm just going to switch my slides over now, and then I'll hand over to Liz. Okay, over to you, Liz.
Great, thank you. Now, can everyone see those slides? Again, if you can just let me know. You should be able to now. Lovely, thank you. So, hi everyone, thanks for joining us for this session. So we're going to be talking about including people with learning disabilities in research today. And as Claire said, I'm Liz Croot. I'm Senior Research Fellow and Director of Learning and Teaching here at ScHARR, and I'm joined by Jodie, Bradley and Vicky Farnsworth, who are experts by experience working for Speak Up. So I'm going to start by talking briefly about the broader context for involving people with learning disabilities in research, and then we're each going to talk about projects we've been involved in to show the ways that people with learning disabilities were included in them. And again, as Claire said, we'll answer questions at the end rather than as we're going through the presentation. So before we go any further, I want to be really clear about who we're talking about when we say people with learning disabilities. So learning disabilities defined as significantly reduced ability to understand new or complex information and to learn new skills, along with a reduced ability to cope independently. And this disability starts before adulthood with a lasting effect on development. I'm going to use the term learning disability today, but the term intellectual disability is also used in academic research to describe this population. And sometimes you also see the terms cognitive impairment or intellectual impairment, but those terms may include people with acquired brain injuries or with dementia. And whilst there might be some similarities, there are also important differences. And learning disability is also distinct from autism and Asperger's and other specific learning disabilities like dyslexia and dyspraxia. It's important to point out, and I can only do that very briefly, but it's important to point out that there's huge variation within the population of people with learning disabilities. So there are differences in the severity of learning disability and the level of support that people need, huge variation in lifestyles, with some people living and working fairly independently with minimal or no support, whilst other people may need one-to-one support and 24-hour care. So whilst it's important to stress the variation within the population of people with learning disabilities, it is well established that as a population, people with learning disabilities are more likely to have poor health compared to people without learning disabilities. And obviously that's a very broad statement. There's a lot we could say about that. And we would also want to highlight how people with learning disabilities are disadvantaged and marginalised within society. But that isn't the focus of this session, except to say that they're also widely excluded from health research, and that's why we're here to talk about ways that we can include people. So to give you some idea of the extent of this exclusion from health research, in 2019, there was a review of all studies recorded in the NIHR portfolio. So I don't know if there's anybody joining from overseas, but the NIHR is the National Institute of Health Research, and it's the way that the Government Department of Health and Social Care funds health and care research in England. So this review was of all the past and present studies in their portfolio. That's over 26,000 studies. And the review found that 60.3% of all those studies excluded people with learning disabilities. And only 1.4% of those studies were specifically related to learning disability. And that's something that clearly needs to change. So including people with learning disabilities in research is seen as challenging for a number of reasons. It may be that people with mild learning disabilities may not be using services, so they're very difficult to identify and to as a population, whereas people with more severe disabilities might be hard to recruit because of their communication needs, for example. People with learning disabilities are often assumed to lack capacity to give their consent or to understand and discuss research-related topics. They might be protected from taking part in research by well-intentioned sort of family members or support staff who are acting as gatekeepers. And researchers themselves may hesitate to include people with learning disabilities because of concerns that they're vulnerable and they should be protected from harm. And there's clearly a tension there between the need to protect people from harm, but also the risk that comes from excluding them from research that will affect their health and their lives. So involving people with learning disabilities in research may mean including them as participants in a research study rather than routinely excluding them. And a driver for this is to improve the external reliability of the study. So what I mean by that is the extent to which the population within a study represents the population to which those results are going to be applied. And important to note that healthcare interventions that are trialled on a general population might not work in the same way for people with learning disabilities, certainly given they may not work for all people with learning disabilities given the variation within that population. So I've given a reference there for anyone who's interested in including people with learning disabilities in trials specifically, but that isn't what I'm going to focus on today. I'm going to talk about, or we're going to talk about, including people with learning disabilities as partners in the research process rather than just as participants. And the drivers for this are, firstly, that all patients and people have the right to be involved in things that affect their lives, and that includes health research. Secondly, there's an increasing understanding that experiential knowledge that experts by experience bring to research contributes to better outcomes, because those outcomes are more relevant, they're more credible, and they're more acceptable to end users of the research. And thirdly, in the UK, national policies and funding bodies now expect patient and public involvement and engagement in research. And in the Equality Act of 2010, there's a statutory requirement that all public sector bodies should make reasonable adjustments to ensure equality of access for people with protected characteristics, which includes people with learning disabilities. And that equality of access includes access to taking part in research. So I'm going to use a project that was funded by the UK Medical Research Council to describe how people with learning disabilities were actively involved as partners in the research process. And I'm also going to talk about how we ran focus groups within that project for people with learning disabilities. So the background to this project is that there's a higher prevalence of overweight and obesity in adults with learning disabilities compared with the general population. And Slimming World is a programme that's been shown to be effective in achieving weight loss in the general population. So we were looking at adapting this programme for people with learning disabilities rather than developing something new that was specific to people with learning disabilities. And for those who don't know, Slimming World's a UK-wide commercial company that delivered a multi-component weight management intervention via weekly groups in community settings. They do offer online options, but this project focused specifically on face-to-face delivery, so that's what I'm going to be talking about today. So I'm going to talk about the project steering group and then about the focus groups that we ran. So starting with the steering group, before we embarked on the project, we worked with the local authority People's Parliament, which was a group where people with learning disabilities could discuss issues that were of concern to them. So we went along to this forum to test out interest in the project, to find out whether people thought this was something that was important and whether this was something that they wanted to be involved with and felt was worth taking forwards. and thankfully they said yes. We were pleased that they sort of shared our concerns about this issue. And from this People's Parliament, a number of people came forward to say that they were interested in the project and they would like to be involved in it in some way. And they were people who were either interested in the topic, so they were interested in food and weight management, or they were just interested in being involved in research more generally. And so we invited them to form a study steering group, which ended up being made up of 4 people with learning disabilities. To help them prepare for this, we took them to go and sit in on a Slimming World group to help them to see the programme in action and to learn more about what was going on, what it was like and how it worked. So they'd got a concrete experience of the things that we were asking them to comment on. They knew what we were discussing and they could then contribute meaningfully about what they'd seen. They weren't relying on abstract kind of verbal or written descriptions of it. And the steering group of people were actively involved in the design and the delivery of the research, but the way in which they were involved and the emphasis of their contribution did vary depending on the particular project task. So there were some tasks that we, the academic researchers, led, and we asked for comments from the steering group. And there were other stages where the steering group took more of a lead and they told us what we needed to do. So to give examples of what I mean by that, so myself and the research associate working on the project planned how we were going to collect data from people with learning disabilities. We decided on focus groups, on individual interviews, and we discussed that with the steering group so that they could comment. They could comment on the sorts of things we might want to ask. They commented on the way that we would phrase questions. And to make this easier, where we could, we asked them to choose between 2 or sometimes more alternatives, rather than asking them to come up with their own ideas about how we should collect data and what was the best way to go forwards. It was slightly different when we were talking about how we were going to give information and gain consent in ways that were accessible and understandable for the people who were going to take part in the study. In that, we were guided by the steering group. We knew the information that we had to get across to participants, but the steering group members told us how to present this in an accessible format. And in this particular instance, accessible meant using short sentences with simple words to explain what would happen, along with an image that was relevant to the written information that would kind of support understanding of the written information. And our steering group members suggested images that we could use, and when we developed those images, they selected the ones that they thought were most clearly illustrating the point that the meaning that we were trying to get across. I should say at this point, I was really fortunate in that my research associate, Melanie Rimmer, was a very, very good artist, and so she was able to actually draw the illustrations as people were talking about them, and to make changes to them with the steering group. So again, they were there in front of us. You weren't having to imagine what things were going to look like. She was able to sketch them quickly during meetings. So yeah, the steering group contributed in different ways and to different degrees depending on the stage of the project, and where their particular expertise and experience was the most relevant. We worked with this steering group throughout the whole project, but I want to move on now to talk about the focus groups, and I'll come back to the steering group just very briefly at the end. So we collected data in this study in a number of different ways, so focus groups, but also individual interviews with people with learning disabilities, and we also interviewed carers and supporters and the people who who led the Slimming World groups, but I'm only really going to talk about the focus groups today because I want to have time to go into a little bit more detail about how we adapted them. So to set up our focus groups, we worked with third sector organisations to identify pre-existing groups for people with learning disabilities, and we were particularly looking to go to groups where there was an interest in food or health more widely, and where we thought they might be amenable to help us running a focus group during one of their group sessions. And we knew that we couldn't necessarily rely on written information to make sure that participants could understand what the study was about. So we adapted the way we gave information to the people in these groups. We gave information about the study to the person who led the group so that they were able to talk to participants in advance, get agreement for us to go along and visit the group. When we visited, we talked to the group about the project and we asked them simple questions to check that their understanding and to gauge what they were taking from what we were saying. Before we asked each person whether they wanted to take part. Now, usually in the UK, ethics committees like to have a period of time between giving people information about a project and asking them to give consent to take part. And so I think it is important to make the point that people with learning disabilities may have understanding within a particular context that's linked to that situation. And the idea of coming back another day and expecting them to remember the information doesn't necessarily support their understanding and their ability to give their consent. As part of our consent process, it was very much an ongoing process, and by that I mean we made sure that there was alternative activity available, so that if people chose not to join in, they could leave at any time during the session and go and do something else, and some people did certainly do that. As we were talking to the groups, we did note that some people didn't seem to have decision-making capacity. And where this was the case, we didn't exclude them from the group or from the activities that we had planned, but we didn't collect data from that. And in some instances, there were discussions with the person who led the group, who knew people well, to just clarify whether or not that was the case. So, in the groups, we led practical activities, and we obviously tried to make these fun. So we did things with food, as you can see from the picture. We looked at identifying, selecting food, preparing it to eat, sometimes cooking. And as we did that, we talked about how people made choices about their food and what they wanted to buy or cook or eat. And we also talked more widely about joining and being part of a group and the things that they enjoyed and things that they perhaps didn't enjoy so much. So during the groups, we had concrete activities, and we were asking people to talk about what they were doing whilst they were doing it. So they didn't have to rely on memory or on abstract ideas. As we went along, we kept a record of what we were learning from the group, and we did this using big sheets of A3 paper that usually were pinned up on the wall, or they were somewhere where people could see them, so that people didn't have to remember what we talked about. They could see what we were talking about, they could refer back to this. And in that way, we tried to sort of support their understanding about what we were gaining from the group and what we would be taking away. And we referred back to these notes. We read them out to check at the end that the people there agreed with what we'd got. And again, we used simple, clear words where we could, pictures, if we could, to make this process accessible for people who couldn't necessarily read those sheets for themselves. So we took the information from the focus groups back to the steering group, who helped us to summarise what we'd found and just briefly to let you know how that project worked out. When we had all the relevant data back from the project, we developed a list of modifications, which the steering group helped us prioritise. And from this, we used that to make recommendations to Slimming World. And Slimming World then took those recommendations and developed prototype materials for people with learning disabilities. And the steering group reviewed the first draft of the prototype for us, and we fed their comments back to Slimming World, who produced a second draft, which we were then able to test with a small group of people. So I'm not going to say any more about the project. I want to just finish by sort of summarising what worked well with this. And what worked well, as I think I've stressed, is having something concrete for people to do that we could talk about as they were doing it. So rather than abstract ideas, we weren't asking people to remember things or to imagine situations or to come up with their own ideas. As I say, what we tended to do was try to offer people choices between different things, rather than asking them to come up with the ideas themselves. We tried to make sure we were doing things that people would enjoy, so we tried to make it fun and keep things interesting. And I think it was important to have plenty of activities up our sleeves, because it was very clear if people were struggling with something or just getting bored, you need to be able to move on quite quickly to another activity where that's happening. Simplifying ideas and trying to use accessible written and verbal information. So trying to keep things succinct, using simple everyday language rather than any technical terms or jargon, and using pictures or actual objects to try and support understanding was helpful. Repeating things and circling back to check that people had understood things. So asking questions just to gauge whether people are understanding worked well. And I think the other thing that's really important is allowing people time to talk about their own issues. And I think this was particularly relevant to us because we were using pre-existing groups. So in some ways we were coming onto their territory and using their time to talk about our project. So it was very important to allow them time to talk about the things that they wanted to talk about. So there was some sort of reciprocity, there was some sort of give and take. They weren't just there for our purpose. And just to say a little bit more about using pre-existing groups, because obviously it might not be relevant in some cases, but we could do this because our inclusion criteria were broadly people who were accessing services for people with learning disabilities, and we wanted to talk to people who liked and had experience of attending groups. We were much less successful when we tried to set up separate research meetings. And I think people with learning disabilities are busy. They have daily and weekly routines, and they may be less able to juggle their schedule and to accommodate something different. And that's not necessarily because they don't have the skills to do that. That's not necessarily down to the fact that they've got a learning disability. It might be because of their support arrangements or transport arrangements. So just things to think about if you do need to get a group of people with learning disabilities together is the importance of planning ahead, thinking about how it's going to fit in with people's existing routines and schedules. Okay, so there's a slide here with the references that I've given during the presentation. So if you're able to get the slides, you'll have those references. But I want to hand over to Jodie and Vicky now, who are going to talk about some of the work that they've been involved in. So thanks. Are you okay to take over then, Jodie?
Hello, yes. Vicky, are you back on? Because you left, didn't you? Vic?
I can see that Vicky's a moderator, Jodie, but
yeah, she's there. I don't know if you can just try your microphone for us, Vicky, just so we know you're there.
I am here.
Oh,
fantastic. Okay, over to you, Jodie. Thanks.
Right, so good afternoon, everybody. My name is Jodie. I'm a salary worker at Speak Up as a expert by experience, a trainer, and alongside a friend and colleague, I've been working on the integrated care system for Sheffield, Barnsley, Rotherham and Bassetlaw. Oh, and Doncaster, sorry, I forgot to say that one. So I'm just going to go first on the presentation about the work I've been doing in the care system, and then a little bit later I'll hand you over to Vicky. Oh my word, I hate that photo. Sorry, everybody. Avert your eyes. So, as I've just said, I'm an expert by experience for the integrated care system, and I do lots of jobs, like helping out with training. I feedback information at meetings, and I help to run meetings. I also help to do research, and I'm a co-researcher on different projects that we've done. I've also been a co-researcher for different research projects with universities, for example, the Big Society, Civil Society work, which my friend Vicky is going to talk about later. So the integrated care systems are being set up across the country. They are made up of groups of councils, NHS organisations, clinical commissioning groups, and voluntary sector organisations. They all work together to plan local health and social care services so that they work for local people. Our integrated care system is, like I said at the start, is made up of Sheffield, Rotherham, Doncaster, Barnsley and Bassetlaw. So I've helped out the SCS with their work for the last couple of years. Some of the work I've been involved in, I've helped to create the autism pathway. I went to lots of different meetings and helped to run workshops to find out what autistic people, families and services thought were the most important things for autistic people who live in our integrated care system. I'm just hoping I'm not going too fast for everybody. I hope I'm doing all right. Some of the work I've been involved in, again, I've helped to, oh, thank you. I've helped to run the employment meetings to help people with autism to get into work and to also help to plan for their futures. Thanks, Liz. I've been a co-researcher for the positive behaviour support as well. Probably either all of you or most of you have heard about PBS in your work. For the integrated care system, this meant I had to learn all about positive behaviour support. I then had to carry out interviews with staff and people who had PBS plans to find out if they were for them. I've also helped to run big health days. These were events about tackling health equalities. So we held 2 events and over 200 people came to them. We help people try out sport activities and find out information about their health. Like, for example, one of the workshops we held was about dysphagia and sexual health. So all the work I've been involved in has been co-produced. This means that I've worked together with different people and different organisations on certain projects and research. Co-production means I get to have my say, but at the same time, it gives other people the chance to voice their opinions. Co-production is more equal than other research. Right, so I'm happy to hand over to my friend Vicky now.
Can everyone hear me?
Yeah, we can.
Yes, thank you. Good afternoon. My name is Vicky, like Jodie said. I'm a paid worker. I work at Speak Up as an expert by experience. I sit on meetings. I do the CTRs and the CETRs, which are for care and achievement reviews, and they're both for adults and children. I'm also a co-deduction researcher on the different projects like the Vicky Society, Civil Society, which we'll now talk about on the next slide. I worked with different organisations to find out circles of support, advocacy and employment. I worked with Dan Douglin and Catherine to do this work. Jodie and myself were co-researchers. We delivered a presentation and talked about the work with people with learning disabilities. We got the training in Toronto, Canada, and talked to people about this work. Thank you for listening to our presentation. Any questions?
Vicky, we didn't add that slide in, did we?
Before we actually finish, I can tell you just a little bit. Speak Up. Me and Jodie and some of the colleagues from Speak Up was also a part of a project called Being Warm, Being Happy. There is a film about the Being Warm, Being Happy. If you've seen it or not, I'm not sure, but we were told that we weren't able to get this link. But it's all around with people with learning disabilities, how to keep warm and now in their own homes and how they pay for the bills. It was all around 2 monitors. One went in the bedroom, one went in the living room. It stayed there for 2 weeks, and it was just a temperature to see how hot or cold the room was. That's what it was all around. I'll not tell you quite a lot about it, is because there is a film footage you can watch what's on Speak Up's website, and there is more information about that as well if you want to know more. Again, thank you for listening. Do you have any questions?
Okay, thanks Jodie and Vicky and Liz. So if you want to put questions in the chat box, you can, or if you do want to switch your microphone on, then just let us know, and you can ask questions that way. I can see there have been a couple of comments in the chat box. Louise, I can see that you've asked, well, you commented that you missed the information about how Liz said that she initially approached people with learning disabilities to join her PPI group. Liz, can you answer that?
Yeah, sure. We contacted the local Sheffield local authority had at the time a People's Parliament, which was made up of people with learning disabilities and met to discuss issues of concern for people with learning disabilities. Sadly, the People's Parliament doesn't exist anymore, but that was a really useful forum to go to, and that's where we went to talk about the project. With other projects, I've gone to different groups. They've been health related, so I've gone to the Learning Disability Partnership Board, where there are people with learning disabilities sitting as representatives on that board, so it's not a group exclusively of people with learning disabilities, but that's the other place that I've been. I've also worked with various different third sector organisations in Sheffield in the past to try and identify people who might want to join steering groups, with varied success. I guess same with any work with people and steering groups. We've found that numbers drop off. It's important to think about kind of where you're meeting, and as I said, how it's going to fit in with people's routines. And in some cases we've kind of started off with a steering group but actually ended up almost doing one-to-one consultations because it's been so difficult to get everybody in the same place at the same time. So something like the People's Parliament was ideal because it was somewhere that we could go to talk to people rather than asking people to do something in addition to what they would normally do in their week.
Okay, thanks, Liz. Louise also asked a question. I think this is for Jodie and Vicky. Louise wants to know what the best parts were about your training for your roles. So Jodie or Vicky, are either of you able to talk about the training that you had?
Well, I would say the best part is we as experts actually delivering the training, because we've got lived experience of services and stuff like that. I feel as if it's made more of an impact on the actual session we used to delivering it, because sorry, I can't get the words out. I just feel as if it's more powerful we used to delivering it, and we get really good feedback as well. Like, can we have more training sessions? Can we have more of these resources? Because all the resources we produce are in easy read, and really good speakers. You know, like we have a script that we use, and we take it in turns reading bits. So we've got a really good team together, haven't we, Vicky? So it works really well, doesn't it?
Yeah, yeah, it does. I was just going to say, but like, it's. Sorry about that. That's my daughter. I was just going to turn around and say, but like, it's good. It was also good because like, the part when I mentioned in Canada, we also got a chance to meet other group with people with disabilities, and plus it was like understanding how different their group work from Speak Up, and it was even also interesting, but we got a chance to be a part of the research actually, because we learned different things as well at the same time, and it also shows you about like people with learning disabilities and autism can do training just like anyone else does training, really.
Okay, thanks both of you. There's another question. Have you been involved in any research conducted online during the pandemic? Any of you?
And any research in particular, or just in general?
They haven't specified in the question. I think they just want to know whether you've been involved in research that's been being done online. I know obviously a lot of research has had to shift to an online format, so people are having to do obviously things like focus groups and stuff in things like this and Zoom and what have you.
Oh, actually, yeah, we have recently done some focus group work, and if Vicky wants to jump in again, we've actually done some questionnaires as well. Either a gentleman or a lady from a certain service comes on to our daily Zoom calls to ask us, could we help with a bit of research that they're doing, and it's either about COVID or about housing or anything at all. And when we say, and if we want to, we say yes, and then we go out into a breakout room. One at a time. Whoever's popped on, and we just answer their questions, and then they take it back, and then if they want more from us, then I think they ask us more questions and talk to us about what's going to happen next. So yeah, we've actually done research online quite a lot, haven't we, Vicky?
Yeah, we have. It's very good as well when they also ask us for our ideas and ask us what we think, and does it need changing, and do people with learning disabilities or autism understand what the research is about as well.
Okay,
And
thanks
just,
both of you. Oh, sorry, Liz.
It's all right. I was going to say that I haven't actually been involved in any data collection online during the pandemic, but we've certainly been working with Jodie, with Vicky, and with their colleagues at Speak Up to work on another grant application. So I can confirm that there is, things are going on using Zoom. The meetings are still happening online. They've just transferred online very, very smoothly, really.
Okay.
Yeah.
I can see a question from Tim says, do you have any issues getting ethics approval?
I kind of don't understand that question. Sorry.
Jodie, maybe that's one I can talk about a little bit, because actually we did have the project that I was talking about, the Wild project. We did have
okay.
we did have some issues getting ethics approval. So that's what the permission that we had to get in order to do the research, Jodie, and we had to get university ethics approval, because we weren't using NHS staff or patients, or so it was the university ethics process that we went through, and it was quite difficult to get away from the idea of having signed consent forms, and we had to do quite a lot of work developing a process model of consent, which I talked about a little bit, the way that we talk to the groups in stages, using the person who was leading the group to begin with to explain the project to people, and then we went and visited and talked about about what we were going to do. And although we got consent from everybody within the group, that we collected aggregate data. So by that I mean we didn't collect data from, we didn't report data, individual data. We talked about the group said this group told us that. We didn't report information about individuals within that group, so we gave an age range. We didn't talk about the number of we didn't talk about individuals in the group, and we had to sort of document that process. And in the end, I think we got agreement that the person leading the group would sign consent to say that we'd followed our own process, and that's how we managed to kind of get around this idea of everybody having to sign an individual consent form. So I do remember that that was an issue, and there was a little bit of toing and froing and discussing with the ethics committee about how we could best do that.
Okay, thanks, Liz. I think I'm just going back. Margaret asked if any of you have been involved in any dental care research.
I haven't, but I know there's some interest. I know James was also joining the session, who's a dental researcher. So it looks like there's a little bit of connection there between dental researchers. So, but I haven't been involved in any dental research. No, Jodie or Vicky, have either of you?
I don't recall doing any recently. We've not done any recent. Have we, Vicky? Or have we?
Not recently, no, but in the past we have.
Yeah.
We also have a question from Twitter that Andy's just posted from somebody called Julie. How can I get involved? I have lived experience. So how can someone get involved in Speak Up?
They could email our colleagues, you know, either a lady called Annie or a gentleman called Jeff, if they would like to be involved, and maybe get into contact with any of them. So
yeah, I think on the Speak Up web pages there's a contact us page. I'll just try and find that and put it into the link. If
yeah.
Okay, and one final question before we finish. Sean asked, do you have any tips for involving people with more significant communication difficulties?
For me, this isn't something that I've done, so I don't know that I can really talk to that. I know that my colleague at Manchester, Juliet Goldbart, has done work around people with more profound learning disabilities and communication impairment, but I haven't been involved in that. But Jodie or Vicky, have either of you been involved with people who have more significant communication disabilities or difficulties?
Speak Up has actually worked with different people's needs, even if they have problems with speech, or if they have problems where maybe they can't talk at all. So because Speak Up does different resources, like we make easy read booklets, we make DVDs. And we can change things and support people to put it to their level, so it makes them easy to understand what different projects what we've done. So if you go on our website, on the Speak Up's website, there's a lot of information on there on the different projects that we do, the booklets that we make, and there should be some of our films on there, what we've created. And we have recently done, well, it's new actually to speak up. It's called Self-Heard Voices, and that's how using different tools.
Vicky, it's seldom heard voices. Sorry.
Sorry, I get it. So if Jodie wants to finish trying to help me out with it, that's fine. It is.
Yeah, it's oh, sorry, I thought you meant now. Sorry, Vicky.
Yeah, it's fine. You can come in.
Yeah. So, sorry, everybody. Yeah, like Vicky was saying, it's called the Seldom Heard Voices, and we've recently been producing an easy read toolkit about all this, and what it's about, like Vicky just said, it's about some of our self advocates who are case studies who maybe don't talk a lot, or they hardly get heard. So if any of you would like to see that toolkit, it will be on our website, but it's just in the middle of being produced at the moment. But we will put it on our website, and you might be able to either download it or just have a quick read about it. Yeah, so I don't know if I've missed anything out, Vicky, there, or have I said it all?
No, I don't think you have, Jodie. All I was going to end it with, so I'm not plobbing on, but like it's the tool is actually everyone from Speak Up working in a team, just giving ideas, and all different type of tools what you can use to help people who's got speech problems or maybe not be able to talk at all. So it's still, like Jodie said, it's not quite finished because we're still working on it at the moment. So you might have to just keep looking at it until it comes onto the website. But so far, what I've seen of it, it's a good idea, and everyone with a learning disabilities have had opinions on it, what they think about it, or ideas.
Okay, thanks everyone. I think that's the end of all the questions. So I think we'll end the session there. Just give me a minute while I put my last slide up before we go. But thanks everyone for joining us today. And thanks for all the questions and the participation. It's always really good to get sort of some good, interesting questions from our audience. I've put the links in the chat box in terms of signing up for the next couple of sessions, but I think we do include those as well in the email that we send with the link to the recording of these sessions. So if you look out for that email, there should be links to the joining details for those there. But apart from that, thanks for joining us today. Like I say, we will send the link to the recording as soon as we can. I'm having trouble, my computer's being very slow. I'm trying to share a slide, but it doesn't seem to want to do it, but it may appear in the next few moments, but if not to worry. But yeah, thanks for joining us today, and thanks very much to Liz, to Jodie, and to Vicky for taking their time to deliver this mini masterclass for us.
Yeah, thank you for that.
Thank you very much indeed. Thanks for your interest, and yeah, thank you very much, Vicky and Jodie.
Thank you.
Thank you. You're welcome.